My name is Nurul Fatin Diana binti Aziza Anwar, case number 01GGU22F1079. Today, I will explain about introduction noise. Noise is defined of unwanted sounds and exposure to loud and prolonged noise can damage hearing. Employees who work in areas where high noise levels more than 85 decibel average over 8 house must be enrolled in the Princeton University Hearing Conservation Program. The purpose of the program is to prevent noise-induced hearing loss caused by exposure to this condition. Employees in the program must receive training from EHH every year and are also required to obtain a baseline and annual hearing test. Employees' health is eternal. So this is example of noise and hearing.
Good afternoon, my name is Alia Khalida binti Azhar. My metric number is 01GGU to the F1056. Today I'm going to talk about type of noise. There are 4 types of noise, which is low frequency noise, impulsive noise, continuous noise, and intermittent noise. Here is a breakdown of different types of noise that affect us all. First is continuous noise. Continuous noise is noise that produces continuously. For example, machine that keep running without interruption. You may measure continuous noise for just a few minutes with a sound level meter to get a sufficient representation of the noise level. If you want to analyze the noise further, you need to look at the sound of meter with octave band analysis.
Hi, my name is Ishira Huda, metric number 101 DGU 22F1060. Number 2, intermittent noise. Intermittent noise is a noise level that increases and decreases rapidly. This might be caused by a train passing by, factoring equipment that operate in cyclists, or aircraft flying above your house. We measure intermittent noise is a similar way to continuous noise with a sound level meter. However, you also need to know the duration of each occurrence and the time between each one to gain a more reliable estimate of the noise level. You should measure over multiple occurrences to calculate an average. Number 3, impulsive noise. Impulsive noise is a most commonly associated with the construction and demolition industry. This sudden burst of noise can startle you by their fast and surprising neutral. Impulsive noise are commonly created by explosion or construction equipment, such as split driver or your next neighbor doing some DIY on a Sunday morning. Number 4, low frequency noise. For low frequency noise, you should be using a sound level meter with third octave band analysis, so you can analyze the low frequency that make up the noise. You may also need to look at the C-wave measurement and compare this to the wave measurement, as this can show how much low frequency noise is present. Low frequency noise make up part of the fabric of our daily soundscape, whether it is the low background hum of a neighbor power station or the roaring of large diesel engine. We are exposed to low-frequency noise constantly.
Hello, my name is Muhammad Zain Hakim bin Syed from DG1C. Today I will explain about noise exposure and hearing conservation. OSHA also requires employers to implement a hearing conservation program (HCP) whenever workers' noise exposure equal or exceed an 8-hour TWA sun level of 85 dBA in general industry, also known as the action level, or when level exceed 90 dBA in construction. In general industry, an SCP requires an employer to develop a noise monitoring program, notify employees of hazardous noise levels, allow employees the ability to observe noise monitoring, maintain an audiometric testing program including a baseline audiogram, provide hearing protectors, develop a training program. Host employer responsibilities. The host employer will usually have the primary responsibility for determining noise exposure levels, implementing and maintaining engineering, administrative, and work practice controls, providing appropriate hearing protection, and maintaining a hearing conservation program in accordance with all requirements of the standard for the workplace. Because the host employee is most familiar with and has control over the process in equipment that may produce hazardous noise level that the temporary workers will encounter. The host employer is often the best position to implement an HCP, including but not limited to noise monitoring, proper selection of hearing protection for the condition at the worksite, audiometric testing, and training of employees within the time frames required by the standards.
Hello, my name is Nur Amira bint Habib and my number metric is 01DGU22F1058. I want to present about the staffing responsibilities. The staffing agency shares responsibility for its workers' safety and health and has an obligation to become familiar with any noise exposure hazard and control in place, including an HCP and hearing protection requirement, and the host employer was set prior to assigning workers. As a recommended practice, the staffing agency should take reasonable steps to ensure that the host employer has an HCP in place that covers temporary workers in the same manner in which the host employees are covered. In addition, it is the staffing agency obligation to inform temporary employees of the noise hazard they may encounter and ensure as far as possible that the workers are adequately protected, including following any safety and health rules, for example, wearing hearing protection required by the host employers. Number 3 is about joint responsibilities. OSHA occupational noise standard and requires that employer establish a valid baseline audiogram within 6 months of an employee's first exposure at or above the action level, or within 1 year if a mobile test van is used, and that hearing protection is used in the interim. In case where temporary workers work for multiple host employers for a short period of time, for example less than a year, and therefore may be missed by the host employer's baseline and audiometric testing program, the staffing agencies may be better positioned to meet this requirement. The conclusion about our presentation is noise is ubiquitous in community and workplace setting. Number 2 is noise has a barometer of associated auditory and non-auditory health effect. Number 3 is there are established health standard for noise from a variety of agencies. Number 4 is noise exposure can be reduced through a variety of control methods.